Hello there, and a warm welcome to this EMIC webinar. My name is Gregor Henderson, and it's my pleasure to be your host for today's panel discussion and conversations. I'm the UK board member for EMIC, and it's a very important topic that we're discussing today. The title of the topic is Cascade Impacts, Mental Health Workforce and Community Resilience. Let me just give a little bit more background about this topic. Only a small fraction of the world's population in need of mental health and crisis care have access to effective, affordable, high-quality mental health care. For depression alone, gaps in service coverage range from 77% of people in high-income countries with depression lacking minimally adequate treatment to 97% lacking minimally adequate treatment in low and lower middle-income countries. Access that exists is inequitably distributed, and the growing demand for mental health support is outpacing the supply of mental health workforce through traditional pathways, exacerbating this critical shortage of mental health professionals in many countries. In this growing global crisis, it's imperative to identify dynamic digital mental health models to expand access to effective, high-quality mental health care and support, while simultaneously building the resilience of individuals, communities, populations, and the workforce. Emerging insights suggest that digital mental health and crisis response models that incorporate trained volunteers may do just that. In this webinar, collaborators from the affiliated network of text-based crisis response partners at Mental Health Innovations, providers of Shout in the UK, Kids Help Phone Canada, Text About It by Spun Out in Ireland, and Crisis Text Line in the US. Our collaborators will share insights from their efforts to illuminate the cascade impacts of volunteers through their models. So really exciting and very important topic. Feel free to share your current location in or area of interest. To do so, you can click on the three dots next to your name tag, choose Edit, add your country or area, and this allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the chat box. During the Q&A session, I'll do my best to include as many of your questions as I can in our discussion. Lastly, today's webinar is being recorded, and the EMIC team will soon share the recording in the Knowledge Bank. Now it gives me great pleasure to introduce our first speaker of the day. Our first speaker is Ian Power, the Chief Executive Officer of Spun Out, Ireland's youth information and support platform, working towards an Ireland where all young people are empowered and supported to thrive. Ian is Adjunct Associate Professor at UCD School of Psychology, a member of the National Implementation Monitoring Committee of Ireland's National Mental Health Policy, and was a member of the Irish Government's National Task Force on Youth Mental Health. Ian holds independent non-executive directorships of Community Foundation Ireland and of the Citizens Information Board, and is a former president of the National Youth Council of Ireland. Ian holds an advanced diploma in juvenile justice from the King's Inn, along with a US State Department professional fellowship from Boston College. Ian completed the certificate and diploma in company direction from the Institute of Directors in 2019. Ian, what a very impressive biography, and looking forward to hearing from you.
Looking forward to the chat this afternoon and this evening and this morning, and good morning to everybody participating. It's great to be here, and it's somewhat daunting to be the first of the four partners here to kind of maybe set some context and introduction for what we hope is going to be a really engaging discussion today. So as Gregor said, I'm coming to you from Dublin. It's an unusually and not typical, usually sunny afternoon and evening here in Dublin, and we're a bit delighted to have this conversation with you. So I'm just going to share my screen and just what I'd like to do kind of today is just to give you some background on perhaps kind of what Spun Out is, but really just in this 5 minutes that I have to kind of describe why it is that we chose this model of service provision. So just to give you some background, Spun Out is, as Gregor said, Ireland's youth information and support platform. We've been around for about 20 years, but we're the newest affiliate to the Crisis Text Line network of and family of helplines from around the world, text lines. Our vision is for an Ireland where all young people are empowered and supported to thrive. And the way that we do that is by working collaboratively with young people to support our mental health and well-being, and doing that, creating evidence-based, person-centered digital solutions and creating safe, validating, supportive spaces, which our text line very much is. One thing about the text line is that the majority of our texters often say to us, I'm sure there's somebody else in a worse off position that probably could be utilizing or taking up the volunteers' time, that probably deserves it more. So this is the Spun Out story, something we developed last year, just to kind of contextualize that actually, life can be hard for all of us, and we might all at some point in our lives find ourselves needing to talk to somebody. And, from our perspective, if it matters to you, it matters to us. And so it's a really important context that we try to share, particularly with young people who are often reaching out to us to talk about something for the very first time. When I say earlier, we are by young people for young people, and that's very much the ethos of Spun Out since its foundation in 2004. And really, about 5 years ago, we started to hear from young people that in terms of the support options that we were signposting to, there was no option there to have a conversation by text. There was no other service here in Ireland providing that service. We spoke to 2,000 young people to ask them what their preferred modality was for a helpline, and the vast majority felt that messaging or texting was the most appropriate way that they wanted to have support. We also did a further consultation with our action panel, which is 160 young people from all around Ireland. And what they were talking to us was that rather than professional one-to-one support, they really wanted to be able to talk to somebody who related to them. And this was echoed by a survey of 1,800 16 to 34-year-olds that we did 2 years ago, where really what they want to be able to do is engage and connect with a peer that can understand what it is that they're going through. So when we were looking for a model to choose, the CTL model was something that was really attractive to us, not only because it was text-based and it was tech-based. There's a lot of really smart use of technology to make this service accessible. It's connecting people who want to listen to people who need to be heard, and really the anonymous nature of this service, the collaborative kind of non-directive model that it pursues, and the fact that it has that super smart tech enabling the volunteers to engage with the texters, and for the volunteers to be all trained and to work remotely, and then to have that really important layer of supervision from mental health professionals sitting atop that in order to be able to manage risk and other kind of more tricky situations that we would never expect a volunteer to manage. And so really, it's been a fantastic partnership over the past 5 years. Just since we began, we launched in the middle of June 2020, which is obviously a very helpful time during the height of the pandemic. We've had 194,000 conversations with young people all across Ireland, and we've trained over 1,500 volunteers. And really, one of the key things for me is that around 2/3 of texters share with us that this is they've shared something with their volunteer that they've never shared with anybody else. And for me, that's a really important marker of what a gateway to help seeking this type of service can be. So it's young people talking to other young people and other volunteers, and then opening up that door to perhaps them being more open to help seeking into the future. We're going to have a really interesting conversation later, so I'm looking forward to the discussion, but I just wanted to end by sharing the story of one of our volunteers very quickly. His name is Sean, and here's what he has to say.
I'm Sean, I'm 28 and I'm from Dublin. I was looking out for a charity to join, and I always had an interest in mental health. A while before I joined, I was going through some troubles myself with my own mental health. I decided to go to a therapist about it. I just thought it was easier talking to a stranger. And that's when I realized how much talking can help people. I guess because I found it easier talking to a stranger, I thought other people would find it easier talking to a stranger as well. The organisation is just built around sharing and talking, and how much talking can help. I remember there was one person I was talking to, and they said, "Thank you for being there to talk to. It was the first time I actually felt heard." People are coming to you, and they might be in the darkest place in their life, and just knowing that you're there to comfort them, it means everything to them. It's just a great feeling knowing that you're there for someone else, and it's probably going to be one of the most rewarding things that you're ever going to do with your life.
Thanks very much to Sean for sharing that with us. And really looking forward to having a further conversation around widening the mental health workforce later. Back to you, Gregor. Thank you.
Thank you, Ian, and also thank you, Sean. Please pass on our thanks to Sean. That was a very powerful video. Let me introduce the second speaker, who is Jessica Jarvis, a data analyst with Mental Health Innovations based in the UK. Jess has expertise in research and analytics within the academic and not-for-profit sectors. She holds a BSc in psychology and an MSc or master's in research and statistics, and has over 6 years of experience working for charitable organizations such as Shout, the Samaritans, and Amnesty International in Australia. Notably, she pioneered the development of Shout's annual volunteer survey, dedicated to understanding volunteer satisfaction and impact. She is passionate about using data and research to support the Shout service and to communicate its beneficial work. Jess, we're looking forward to very much to hearing from you, and thanks. Over to you.
Hello, thanks, Gregor, and hi to everyone. It's nice to see some Shout volunteers in the chat, so I just wanted to say hello as well to you there. I'm just going to share my screen and then I'll begin. Hopefully that's shown now. So yeah, I'm going to talk to you today about the volunteer impact we've seen from the Shout service. So to provide some background, Shout has a wonderful volunteer community that's at the very heart of running the service and crucial to the success of responding to texters and having those important conversations that can help people in their most difficult times. So far, over 14,000 people have trained to be a Shout volunteer since 2018 from all different walks of life. Our volunteers are based in the UK as well as New Zealand, and our volunteers in New Zealand make up around 5% of our volunteer base and help to support the higher demand for the service in the nighttime hours. Shout volunteers have taken almost 2.5 million conversations now with over 800,000 texters in the UK since the service launched. And with volunteers being so pivotal to the running of Shout, we wanted to learn more about our volunteers, how they experience their role, and the ways that they benefit from Shout. So in 2019, we ran our first annual volunteer survey to understand the experience of our Shout volunteers, and this year marked our 6th year of running that survey. Each year we explore several different things, so the intentions and motivations behind volunteering to understand why people want to be a part of Shout, the support that Shout volunteers need, receive, and can provide to others in their role to understand what helps our volunteers feel both secure and encouraged when supporting texters, the logistical aspects of being a volunteer to help with our service improvement, so understanding the process behind training, shifts, the communication they receive, as well as the technology we use and how this works for them. And finally, how volunteers can be impacted in different dimensions of their lives by being a part of the organisation. And I'm going to focus on that last point today about the impact of volunteering. So we've collaborated with our affiliates to ask volunteers the following dimensions of impact to understand the skills they develop that help them to be part of the mental health workforce, that influence their career and education, that influence their personal development and mental health, that help the relationships they've been able to cultivate and continue with, and that influence the broader change to their communities and society. We're currently going through the process of analysing this year's survey, so I just wanted to share some of the impact we've seen in previous responses to highlight the transferability of Shout skills into a volunteer's day-to-day life in society. So we've got some quotes on the left, which I'll reference as I go through, but these come from our Shout volunteers in previous surveys, and 91% of volunteers have agreed that being with Shout has given them transferable skills and mental health knowledge that they can apply to their life beyond the platform. And 88% of volunteers have found that being with Shout helps them to be better at listening to others. And those nice quotes on the right reflect the ideas that volunteering with Shout has enabled volunteers to build the skills and confidence to create better relationships with people in their life and their wider communities, to become more empathetic, to improve their listening skills, and to support people at risk from suicide and have difficult conversations about mental health. And in our most recent survey, we're starting to see evidence that some volunteers use these skills multiple times a day outside of volunteering for Shout. And just a bit more here. So volunteering for Shout has helped people personally by giving them purpose and motivation. It's a remote role, but it's given them the opportunity to meet other people and make connections. Many connect online via our platform chats and learning hubs. Some even meet up in person. And it's helped with skills into employment and continuous learning, where a volunteer explains in one of the quotes that they wouldn't have secured their current job had it not been for volunteering with Shout. So I think in summary, by doing the survey each year, we're able to learn from our volunteers, understand their needs and see their amazing stories. And we're able to explore over time how this grows, develops and changes. And the experience of being a volunteer for an organisation like Shout can enhance many dimensions of an individual's life. And that value is continuously seen in the amazing conversations our volunteers are having with texters each day and the personal resilience they're demonstrating, and the skills that they're transferring into their day-to-day life and society to become part of a mental health workforce. So thank you for listening, and I'm sure our volunteers could share their stories as well. Back to Gregor.
Jessica, thank you. That was great. Really amazing and very impressive statistics. Just in terms of the professional and personal impact is just really quite awesome. So thank you for sharing that. And just, you'll keep doing that survey, because to have all of that data over 6 years is quite amazing. So thank you very much for that. I have unmuted myself this time, so apologies for last time. Let me introduce our third speaker, and it's Margaret Meager, the Chief Impact Officer with the Crisis Text Line in the US. Margaret has led data science efforts to explore over 9 million conversations about mental health crisis, leveraging AI and machine learning to contribute solution-oriented insights to the ongoing mental health epidemic, and measure the effectiveness and impact of Crisis Text Line service for volunteers, service for texters, volunteers, and broader society. A senior leader and systems thinker, she brings 20+ years of experience leading complex, large-scale portfolios and collective impact networks to improve equity and well-being of diverse populations around the world. She has technical expertise in mixed methods research, developmental evaluation and impact assessment, grounded in an MA in comparative international development and education, and a PhD in organizational leadership, policy and development, with supporting emphasis in public health and evaluation. Margaret, really looking forward to hearing from you and to hear about your experience.
Thank you so much, Gregor, and thank you, Ian and Jess. I'm going to share my screen and tee up. Great. So thank you all, and thanks to those who are able to join today. I'm pleased to join from the land of the Anishinaabe in Duluth, Minnesota. And I'm going to really focus on the potential for large-scale impacts and cascade impacts through models such as ours that incorporate trained volunteers. I want to start by setting the stage with a short video from one of our volunteers to really give you a sense of where I'm headed.
Hi, my name is JD Schramm, and I'm delighted to be a volunteer crisis counselor for Crisis Text Line. I've been doing this for almost 3 years, and in that time, I've supported more than 600 individuals, anonymous to me, I'll never know, who've reached out to us for help at Crisis Text Line. Not only am I seeing that we are able to fill a critical gap for thousands of texters who reach out to us every day that lack access to other means of mental health support, but I also see that this directly benefits me and my family every day. I use the skills that I've learned on Crisis Text Line to be able to listen beyond the words that were actually expressed, or to simply say, tell me more about that, and then be quiet and allow the other person to share with me. Without a doubt, I see the multiplier effect of the impact of volunteering at Crisis Text Line far beyond the crisis platform every day. And this is just the sort of butterfly effect that I believe we need in our world today.
So Crisis Text Line is a leading nonprofit organization that's been providing free, confidential, high-quality text-based mental health support and crisis intervention for over a decade in the U.S. In 2023 alone, texters initiated 1.3 million conversations from across every state and every county in the U.S., and we're here for them, supporting highly diverse and highly underserved populations. While we've been primarily known for crisis intervention, we've really evolved to see our role as enabling layers of collective impact at scale through three things combined. The first is the power of the technology platform that we all in this webinar today share, human-delivered models, and collaborative network. The same tech platform, as I said, undergirds all the country-specific text-based intervention services of the organizations in the room today. And we're newly expanding that tech platform in order to support a growing network of affiliated partners anywhere in the world in any language to rapidly adapt to their context for impact at scale within this year. We can see that our model is filling a critical gap in the growing demand for mental health support that's far outpacing the capacity of traditional workforce models. An estimated 79% of texters who reach out to us lack access to professional mental health support. And 65% tell us they don't have anyone else to talk to, not even a friend or family member. Crucially, external research suggests that our service is equally effective across multiple and diverse identities and cultures. So that's something that Elisa will tell us more about in a bit. Volunteers or trained non-clinical responders are a critical component of this model for scale and impact. So far at Crisis Text Line, we've trained over 74,000 crisis responders. They've been with us on the front lines of the mental health crisis in the U.S., supporting these 10 million conversations over the last 10 years. To add to the rich insights already shared by Ian and Ireland and Jess in the UK, here's a little bit about what we're seeing in the U.S. Volunteering at Crisis Text Line is a unique experience in several ways. First, the training and work itself are conducted completely online and remotely. Conversations are text-based. And lastly, the experience can include very high levels of emotional intensity. Through our research, we've learned that regardless of these factors, our volunteers accrue strong benefits through this experience. Some of these benefits are consistent with the broad existing literature on general benefits of volunteering overall, like greater social connections, stronger sense of purpose, but many are likely more specific to our training and our missions. As you can see here in the US, 2/3 say that their experience builds skills to help them deal with some of their own problems, encourages self-care, and helps develop a sense of personal resilience. And that's not all. What I just shared with you was based on our research last year. Building on that, all together, we're looking more deeply this year. I'm going to verbally share just a few of the emerging results of our current research in the US. Of the more than 90% of volunteers who report gaining skills to support others in need of mental health support outside of volunteering, more than 80% are routinely doing so, including 20% on a weekly or daily basis. Volunteers are especially providing mental health support with friends and family and at home, but they are also supporting others at work, online, in their communities, and at school. And lastly, 70% of our volunteers feel strongly that volunteering with Crisis Text Line has made them want to work in a field where they can help people. So I've shared just a bit here about the potential for large-scale cascade impacts through models such as these that incorporate trained volunteers, and we all look forward to sharing more with you soon. With that, I'll turn it back to you, Gregor, to bring in Elisa, who's going to dive more deeply into further critical related issues.
Margaret, thank you. That was fantastic. The numbers are really quite phenomenal. 74,000 trained volunteers across the US. That's absolutely amazing. Okay, let me move to our final speaker. That's Elisa Simon, who's the Executive Vice President for e-Mental Health Transformation and the Chief Youth Officer at Kids Help Phone. Elisa brings more than 20 years of leadership experience in healthcare access and nonprofit management to her role as Executive Vice President and Chief Youth Officer at Kids Help Phone. In this role, Elisa oversees Kids Help Phone's national clinical service programs, providing strategy, leadership, and guidance to more than 150 clinical staff and thousands of volunteer crisis responders across Canada. Through her focus on building innovative digital systems that break down barriers to care by changing the way care is delivered, measured, and received. Elisa is driving the transformation of Canada's youth mental health landscape and creating equitable access to support for youth across the country. Under Elisa's leadership, Kids Help Phone has evolved from a phone-based helpline to a comprehensive solution that fully integrates a growing number of access points, programs, and resources, achieving over 13 million interactions since 2020. Elisa, really looking forward to hearing your contribution and to the panel discussion that follows. Over to you.
Thanks so much. Okay, I'm going to share my screen here. It always just takes 1 second for that to happen. Give me 1 second. Okay. Hopefully everybody can see that. So excited to be here today, and I saw some Canadians on the webinar, so fantastic. So I am joining you today from Toronto, which is the traditional territory of the Mississaugas of the Credit, the Anishinaabes, the Chippewa, the Haudenosaunee, and the Wendat, and is currently the home of Indigenous peoples, and we continue to try to steward this land in partnership with them. I'm going to be talking to you about the work we've been doing at Kids Help Phone, particularly around how we're supporting young people from equity-deserving populations. So I'm going to dig into it. So I'm going to dig into it if I can get my slides to move. There we go. So we think of ourselves at Kids Help Phone as a 35-year-old startup. We have been around for a very long time, but even before we knew the words of e-mental health or digital health, we were providing 24/7 professional counseling to young people who we never saw. It was all over the phone. And Gregor, I realize I need to update my bio because we actually have had over 20 million interactions since the beginning of COVID. To put that into some context, if you don't know Canada, we are a country of about 39 million people. And so 20 million interactions is huge in terms of the reach that we have. And we've also achieved the most trusted charitable organization in Canada, something that is important to us. If we want young people to be reaching out for support, we have to be a place that they see themselves and they trust to be able to come. So when we talk about these big numbers of the number of people that we are reaching or other organizations are reaching, the big question that we always need to ask is, who are we not reaching? Because we often say at Kids Help Phone, look, we could reach our 20 million number by really focusing on urban areas. But there are large groups of people across Canada that we know need our service, are not reaching out to other services, and for whom we can actually build partnership and together build solutions that might support their mental health and well-being. And so for us, the place that we really started in that conversation was with Indigenous people. We have provided professional counseling, peer-to-peer, all of these different services for many years. But we really put a stake in the ground about 5 or 6 years ago where we said, we need to do more to be there for First Nations, Inuit, and Métis people in Canada. And it's not just about driving volumes. It's really about how do we develop really personalized, meaningful e-mental health solutions that support what could be our most vulnerable people. And for Indigenous people in Canada, they account for about 41% of homeless young people, about 50% of our trafficking victims, and they have some of the highest suicide rates in the world. And so in 2019, we released our first action plan, which was looking at how do we support First Nations, Inuit, and Métis people. And as a part of that, what young people told us is that they wanted services that were made for them But they also wanted the ability to either access specific services or not. And here's a quote from a young person who participated in engagement sessions we did all around the country. And basically what they're saying is that there's times where they want to reach out to an Indigenous counselor or an Indigenous supporter, and there's times when they're not wanting that. And for us, the ability to provide services and supports, particularly to equity deserving populations, really hinges on the ability to use volunteers, to be able to get enough volunteers of particular groups to build out the kinds of supports that our equity deserving populations are asking for. So for us, we worked on developing community-based programs like we have a Brighter Days wellness program that is directly in communities providing wellness support. But in order to build out the texting service that we've been talking about today, we needed to really think about how can we scale this so that if Indigenous young people are reaching out, they could connect with an Indigenous supporter. And we couldn't do that with our professional counseling service. So we set up a keyword match where we take a distinctions-based approach. First Nations are different than Inuit, who are different than Métis. And so we set up a keyword for each of those where young people could text into us First Nations, Inuit, or Métis. Then we had to recruit and train crisis responders from those communities. And that means doing deep community development and relationship building so that people want to join the work that you're doing. Young people can text in using those keywords, and when the keyword is received, texters are manually transferred to a crisis responder who has that same background if available. So we have trained about 7,500 volunteers over the last few years at Kids Help Phone, and about 500 of them have been Indigenous or Black youth, because what we learned, excuse me, from our work with Indigenous populations was that Black youth also wanted the same kind of service. We saw over the pandemic, excuse me, the incredible impact of racism on young people. And so we started our Rise Up service. We, as a part of that, as you can see on this, young people can text the word RISE. We have recruited Black crisis responders and trained them so that they can better support Black young people. I'm so sorry. I'm going to get a drink of water quickly. The important thing about doing this work is it has radically increased our reach. When you talk to Canadian organizations, they know about the need for services and supports for Indigenous youth and Black young people, but they often talk about the low representation of those populations within their services. You can see here about 10% of our texters identify as Indigenous now, about 6% identify as Black, both significantly over the percent in the Canadian population. This is just a bit of our impact. I don't want to take too much time, but you've heard some of the impacts from some of the other speakers. We have found similar impact for our equity deserving populations. Really importantly, about 75% or 76%, depending on Black or Indigenous, share something with us they have never shared with anybody else, really showing the safety that they feel within this service. And so excited to talk to you about the work that we are doing and that could be done in other places to better support equity deserving youth.
Elisa, thank you. That was incredible. Really, really good. Amazing reach. And I just love that whole community program, community development approach. I mean, you're having a really radical impact. That's fantastic. I think everybody can learn from the programs that you're putting in place and the methods that you're using. Really great. Okay, let's all come in and join the panel discussion. Remember, audience, please put your questions or thoughts into the chat. I'm going to facilitate a discussion with the panel just now, and then I'll come to the audience, and we'll try and get through as many questions as possible. But let me just start off with quite an easy kind of mix of questions, really. But it's really, and we've heard the impact that volunteers can have. We've heard the difference that it can make. And we heard those shocking statistics at the beginning of the seminar. How can volunteers really provide that effective mental health and crisis response support? How can they do that? And what are some of the criticisms or critiques that your services receive, and how do you counter some of those critiques? Let's start, Ian, with you, because that's pretty obvious. You went first. So let's start with you.
Yeah, I mean, I think for me, most people want to relate. They want to be heard. They don't necessarily need formal or professional intervention, especially when we consider and look at the data that like most conversations we're having with young people are about, kind of stress or worry that's driven by systemic or kind of structural issues. So, it's access to housing, it might be finance. Often it's interpersonal relationship issues, intimate partner kind of issues. And so it's not maybe perhaps young people aren't necessarily in a space where they need formal intervention. If anything, to address some of those issues and to reduce their worries and stress, it's actually about getting them access to things like housing or finance support. And so really kind of being able to relate, even though it's completely anonymous, it's incredible how much you can connect over the medium of text. And to the second part of your question, I think that's probably the thing that perhaps we hear most often is a skepticism as to, well, can you really build rapport over text, when actually it's incredible the rapport that you can build. And it kind of reminds me of my philosophy lectures in college, where you're talking about Rawls and the theory of ignorance, and actually it kind of brings you back to that place where it's really interesting. You may have some, as a volunteer, kind of idea of who you're talking to. Sometimes you can sense that maybe it's a little bit younger, and obviously, depending on the issues that they're discussing with you, but really you've no idea who this person is. And likewise, the texter has no idea who the volunteer is. And yet at the same time, one of the incredible things about the technology that Crisis Text Line has gifted to all of us is that when a texter leaves a piece of feedback for a volunteer, some of the quotes you might have seen from each of our presentations, like when the volunteer logs in the next time, that feedback is ready and waiting for them and added to their profile, and they can see the difference that they've made in the lives of the texters that they're supporting. Like it's remarkable. And even the volunteer that Margaret shared with us, like 600 conversations. Like that's wild that one person can have that ripple effect on a community. We have a volunteer who's responsible for, I think, nearly 3,000 of our conversations, our 194,000 conversations. And just to have that ability to have such an impact is remarkable. And it's just so simple. It's empowering people to be better listeners. And the final thing I'd say on that is that, a lot of young people talk to us about, when they go to the people closest to them in their lives, and it's often parents, kind of there's the immediate and the irresistible urge to jump in and try and fix a problem, when actually most of us need to sit and feel heard and to kind of to explore and to go deeper and reflect. And actually that's really, I couldn't get over, once we had the service maybe up and running for about a year, how many comments in the feedback was, this is the first time I felt heard. And I think that's something really we need to reflect on. I think it's true of all of our 4 countries. I think it's something that we really need to reflect on. Why is that not happening out in wider society? And I definitely think that some of the data Margaret shared hopefully is kind of telling us that the volunteers that we have trained are out there in the community making a difference, even when they're not volunteering with us as well.
Great. Jess, let me come to you and just ask a little bit about some of the training and supervision that you provide to volunteers, and maybe share with us some of the journey that volunteers go through from when they first sign up to when they really get into the stride of things. So give us a flavor for how things develop and how you train and supervise and support people, and the impact that has on volunteers.
Yeah, sure. So volunteers sign up, there's an application form on our website, and then they enter a cohort where they're with, I think it can be anything now from 100 to 300 other people who are training with our team of coaches and trainers. So we have a group of around 10 people possibly more now, who will be kind of dedicated to the trainees, help them through the process. They go through a 6-week process of kind of answering various role plays. We have a simulator which helps the trainees to see what a conversation with a texter would be like before they actually have the conversation with a real life texter online. And once they've gone through their training, then they'll go onto the platform where they'll be supported by our clinical supervisors when they're on shift, and they can always reach out to their volunteer support members and coaches to kind of get feedback on their conversations and to discuss things that might be difficult. They also have the chats on the platform where they can talk with each other. I think peer support and volunteers supporting each other is a really big thing in our community as well, and I think it's really important. They often share I got some feedback today from a volunteer actually that the best kind of conversations they have are when they can share with other volunteers on the platform in real time what might be a good response to different things. So yeah.
That's impressive. Really impressive. Let me move on to another topic. And Margaret, maybe you want to also address some of the common critiques that you receive. But Ian put up some data where there were over 2,000 escalations to emergency services. Margaret, can you talk about that and how Crisis Text Line and your other collaborators deal with escalations and how you safely look after someone until they're handed over properly to emergency services? That would be great.
Yeah, thank you. That's a super important question. Essentially, I think we all focus on triaging conversations as they come into the queue. So essentially, much like a physical emergency room in a hospital, we're looking at the conversation using machine learning to identify the risk of harm to self or others as early as possible in a conversation to then put folks to the front of the queue. So that's one of the things that we do straight out. But then our entire training model is focused on de-escalation and on finding the strengths within the person who's reaching out themselves to help calm down and find a sense of safety and to develop a safety plan. So throughout the conversation, we're doing risk assessment that's built into the model. At high level, then I'll say with Crisis Text Line, what that means is 99% of those 1.3 million texters who reached out to us last year, or the 10 million over time, 99% are resolved and end without the need for any kind of emergency services intervention. So it is rare for us to not be able to de-escalate someone who is in need of support when they reach out to us. And then for those who do need emergency services intervention, then we do reach out to third-party support as much as we can. But again, it's very rare. And we focus on safety planning so that it's not just the moment. This is anonymous, so we don't know who these people are. We don't know necessarily specific where they are. So it's really important for us to help them identify strengths within themselves and a plan that they can carry on beyond our exchange with so that they can continue to find strengths. Some of the things that we've been working on in the last couple of years to really fortify that is also to look at listening to our texters and what they tell us works for them to help them calm down, help them feel better. What are the coping strategies, mechanisms, and resources that they need in order to feel better? That for us has resulted in a number of things, threefold. One, we have resources that we make available on our website to the public around these domains and buckets of drivers of challenge, and here's where resources are available. Those are also integrated and embedded into our platform and available for those who are responding to them. And then we've also put out research on specifically young people and youth resilience. What is it that young people say works for them and is in sort of low-hanging fruit within reach of anyone? And we can more broadly share those insights with the world. That was produced last year and a half ago. And then this year, we really focused on community resilience. So you can only go so far in responsibilizing youth for their well-being. We are responsible collectively at social and community and society levels. So we've looked at what is it that goes above and beyond the domain of control of a young person that they need us to be paying attention to at policy levels and at practice? So we've got a community resilience report that's identified 6 buckets of things that young people need to be able to live well and to be well. So that's sort of a lot of information that I've thrown at you.
Yeah,
in
but
terms of
that's a really crucial advocacy role that you play in raising that. Do you want to say anything about the critique before I hand to Elisa? Because I've got a segue between what you were saying about social and community levels. Do you want to say
Yes,
anything about some of the
yeah,
critiques that
absolutely. I think, critique is, especially in the advent of generative AI hitting mainstream like a tidal wave last year.
Right.
There's always a question of whether we're a bot or whether we're a real human being. And I'm
Okay.
going to circle back to Ian's point about really conveying a sense of care. Genuine concern is something that we're really looking at. In fact, as we speak, our colleagues in Crisis Text Line are preparing to present on some new research focused using natural language processing to be able to really assess and measure what is it that conveys genuine concern in conversations to a texter. How do you build that rapport, and how can we do that better within and beyond the platform? And it is remarkable. This is a clinically powerful dimension for us to focus on. In a conversation where the texter perceives genuine concern by the volunteer, they're 10 times more likely to find the conversation helpful and 5 times more likely to experience reduction in suicidal ideation, just with the words that convey care and concern. So
Yeah.
way more to come on that, but that's the antidote to the bot.
Yeah. That's going to be really interesting, and also the way in which the advocacy and the awareness levels rise in terms of, who am I speaking to? Am I speaking to a real person or am I speaking to a bot? And I hear some people say that for young people they don't mind. I'm not sure. I don't think we know that yet. I don't think we know enough about what young people really want to hear and respond to. So I'd like maybe to address some of that in some of your responses. But Elisa, let me come to you, because one of the things that Margaret was talking about was the social and community level. You've really grown your social and community impact by reaching out to different populations. And if you were advising an organization in a different jurisdiction, say in a low to middle income country, in establishing a service, how much emphasis would you now put on those community connections? And it really speaks lively to Margaret's point about getting that advocacy out to the community. So there's not just the service, but there's also community activation. You got any thoughts?
Yeah, I mean, so I've been at Kids Health Phone for about 12 years, and my first few years, we would often get asked questions like, how do you support Indigenous youth? Or what's your relationship with Black youth or newcomers? And our answer for a very long time was, our service is available to everybody. We do training with people to be able to support those populations. And we look at our evaluations and their outcomes are just the same.
Okay.
The problem is, and I think a lot of organizations, you can feel that, you relate with that, because it is hard. It is hard work to say, actually, that's not enough. It's not enough for us to say we try. And so what Kids Help Phone did as a part of our work in reconciliation for Indigenous people is we said, we actually need to bring in Indigenous staff with a council of all made up of Indigenous peoples, 50% of whom will be youth. And they actually need a seat at the board of directors so that they have power to hold us responsible for actually making changes in the ways that we work. And that includes that we really have co-creation, deep relationships, and it takes time. The reality is, we talk a lot about the amount of effort that we put into our partnerships and our work with equity deserving populations. It costs more, and it actually gets you less in terms of things like volume.
Yeah.
But what you make up for that is in reach to some of those young people that need you most and who we see aren't going to other kinds of services and supports. And ultimately, I often say that moment of courage when a young person is willing to reach out to one of our services or something else, they might only get it once. If we get it wrong, we actually can do harm. And so if we're going to be going out to those communities, building trust, building relationships, really showing meaningfully that we want to be a part of solutions for those communities, we better make sure that when they get to us, every single person is trained to support
Yeah,
those young people, that they
yeah,
understand the needs of those populations and communities. So it is hard work, but I think we as charities and organizations in the e-mental health space, we actually owe it to the people in our communities to not only put words behind the fact that we're there for everybody, but actually do the work. And it takes funding, it takes strategy, and it takes time.
right.
But it actually reaps a huge amount. What we see now is Indigenous communities asking for signs in remote areas where they want to put up kids' help phone materials. We
Yeah,
see influencers who are Indigenous coming and saying, can we be a part of the work you're doing in communities?
yeah.
So it's critical, but it is hard, Gregor.
Yeah, but I think that hard and critical, that comes together, doesn't it? And I think one of the things is, every organization, irrespective of their governance, should be looking at the social impact they have and what they leave behind. And I've judged a lot of tenders in my time, and some of the organizations that fill in the social impact section of tenders really need to go back to the drawing board. And I think you've given them a blueprint for doing that. So thank you. Um, can I ask a few more questions that have come in from the audience? One is about retention. What's volunteer retention like? So Jess, I'm going to come to you on that. Each of you to say how your service model is funded in your jurisdictions, but very, very brief ones. And then I'd like someone to say something about single session interventions. Are you in? Are you out? Do you need convinced? Are you convinced? What are you? So Jess, let's kick us off with retention, and then we'll go through the line on those other points.
Yeah, I think retention is difficult. I think volunteer retention is always a topic that comes up. It's something that at the end of the day, the people who are taking part with the organisation are doing it voluntarily. And we see good retention, I think, at Shout in terms of we ask questions in our survey at the end of the year, usually to ask people if they intend to volunteer with us for the next year. And the majority, I was trying to find the stat when I saw the question, but I can't find it. But the majority do say that they will continue with us for the next year, which is always promising. I don't know if I can speak to the other affiliates, but yeah,
Okay.
I think it's a difficult.
Cool.
I also think
Yeah,
it's
let's-
interesting for us to think about what retention means. There's retention
Yeah.
for both staying with our service, but part of the stats, Margaret, that you were sharing and that we are all collecting right now is what does it mean to your life, your family, and your community to be a volunteer? And so I like to think about retention in all of the different ways. Yes, we want them on the
Very
Kids
good.
Help Phone platform, but there's more
Yeah.
than just that.
That's good. And there's something about research doing, to be done where you can follow up some volunteer counselors over a period of years and just to see where they go, what they do. Wouldn't that be great? Some kind of longitudinal study with some qualitative, in-depth narrative around it. Ian, let's come to you. Let's move on to the funding. How do you fund your services in Ireland?
Yeah, well, what was great about that is that we, around the time of the National Youth Mental Health Task Force, is when we were talking with young people around what they might like and what they need. And we were able to include a texting service in the final report. So it meant that the government were mandating the health service here to provide that service, which was very helpful. And so it's fully government funded, which is fantastic.
Great. Margaret, in the US, funding model?
Our funding model as a nonprofit, essentially, we have a mixed and diversified bucket of funding, but it's basically high net worth individuals, foundations, donors of any type, and many of our volunteers, for example, and texters themselves we don't know necessarily unless they tell us, but so it's really a whole combination of those things, as well as we have some sort of sponsorships and collaborations with different government contracts, different state departments of health, for example, where we provide our service through a portal of theirs, or through different organizations. So it's really a combination of things. And we keep all of that information very publicly available on our website as well.
Great, that's really good. Elisa, how about you? Are you totally government funded, or do you have a mixed model?
No, so interestingly, Kids Health Phone was started as an organization that received no government funding. We have changed that over the last few years. So now about 50% of our funding is from government. But absolutely, like what Margaret was saying, we really look at corporation, we look at individual donors, foundations, and governments together to be able to provide all of our different services and supports across Canada.
Ian, we're all sitting here going, that's amazing. How long is the contract for, will be the next question.
Well, it's interestingly, it's not a multi-annual. Our government don't do multi-annual, so there's no multi-annual contract, but it's very much embedded in the health service. A colleague of yours that you might know, Derek Chambers, he's our lead kind of funder, and he's incredibly committed to digital mental health and digital mental health solutions. But yes, we are a community and voluntary organization, so we are at the mercy of government and state funding for sure. So it is high on the risk register.
Okay, great. What about single session interventions? Margaret, let's come back to you. Jess, please pipe in if you want to say anything about that as well. And then I'll come to you, Lisa, and then Ian. Single session intervention.
Here, I just want to clarify, you mean just that one-off care moment when they reach out for the conversation. We're anonymous, but we do allow texters to reach out to us more than once, and some people need multiple conversations and some just need one. So we don't preclude folks from coming back for additional support, but we're always trying to provide them and offer resources. We never force resources on anyone, but we always offer resources in hopes that they will also be able to make sure that they get care along the continuum. But again, I think I mentioned in our data points, 79% of texters that reach out to us are estimated not to have access to professional support. So we have to be pretty creative there. And I think turning them away would not be our answer.
Yeah. Okay, good. I think we've got a good answer to that. Let me ask a question really about the whole notion of making sure that you are reaching out to different communities. Elisa, we've heard a lot from you on that. But I think one of the things is people really kind of want to know if there's a shelf life for volunteers in mental health. It can be pretty tough. What do you do supporting people? Elisa, let's come to you.
Yeah, so we often say at Kids Health Phone, we need to take care of our front line if we want them to take care of people, right? And for us, that's both our volunteers. We have about 1,500 active volunteers, but it's also our paid professional counselors who provide single session counseling. And so that includes good training, debriefing, recognition. So the kinds of things we were talking about earlier, where do you know when people are thanking you? There is something beautiful about having that moment of gratitude from someone that you've supported. And ongoing, you need those things ongoing. And then moments of recognition from your colleagues and from the organization to say, thank you. So within the platform that we all use, when volunteers reach certain milestones, we recognize it on the platform, and we also will send them something as gratitude to say thank you, so that we know those volunteers that have put in long hours. And I'll say the reality is this is hard work. And sometimes we need to say to volunteers, maybe you need a little bit of a break. It's okay, you can come back. But we have to make sure that our front line is taking care of themselves so that they can take care of others.
Great. I had one more question, but we're going to run out of time, and it's pathways. Ian, if you can have just a very quick moment, it's how do you, someone's coming in and you're referring on to others. How do you keep yourself up to date with referring on to other community resources?
Well, this is a really good question, actually, because we're in the process of developing a dynamic signposting tool, which we hope will help us to do that better, right? So at the moment, in the collaborative kind of you know, when we're asking texters to kind of think of their support network or what might be helpful to them, you know, we're kind of narrowing that down to maybe 2 or 3 options, when really what we want to be able to do is give them a link to something that they can explore themselves, fill in a little bit of information about their, you know, situation, and then what are your preferences? What would you like to get? Where are you in your help seeking journey? Not everybody's ready to talk to a professional. Some people might want something more informal. So yeah, we're doing that at the moment. Excited.
That's good. Maybe we can hear more about that when we move into the next thing. So thank you, everybody. Margaret, you've got something that you'd like to say before I round us and complete it. But if I can hand to you, Margaret.
Thank you so much. I just wanted to share that we are all so excited. We're working collaboratively on a collective impact report that's really focusing on a subset of the same questions that we're asking across our volunteer communities. So we'll be ready to launch and share that at the EMIC Congress in September. And so if you're interested in this, stay tuned, and more to come there. We're just really excited. It feels like we're just getting going.
Great. And so you heard that here, folks, the EMIC Congress, 19th and 20th of September in Ottawa. You got to get registering now. Places are going like hotcakes. So please, please register. Okay, well, we've come to the end of a session. That's it for today. Thank you for letting me go 1 minute over. It's been a pleasure having you all with us. And I'd like to thank our panel members, Ian, Jess, Margaret, and Elisa. Thank you all very much. That was a great webinar. Thank you for your contributions. Goodbye, everyone.